All right. Hey, thanks. For those of y'all looking at your program, unfortunately, Vanessa Gamble is not joining us today, so we have lots of extra time. So we'd like to try and wrap this up by about 3:45 at the latest, but I think we're all good on time. That leaves plenty of time for questions. And so first up today, Mark. All right.
All right. Okay. Hi, I'm Mark Humphries. I'm an historian. I'm here from Newfoundland, Canada, from Memorial University. So I will be speaking from a historical perspective, as Nancy will as well, I think. And so that's kind of my background, to give you some idea of where I'm coming from. So I'd just like to begin by thanking the research team for inviting me to attend the symposium. It's very much an honor to be given an opportunity to share my thoughts alongside the accomplished scholars on the program, and I'm very much humbled to be included amongst them. I have to say that I'm fascinated too to see the results of an innovative digital project in digital history that, I think, like any good study, raises a number of important questions. And in this case, I timed myself perfectly because I would have gone over otherwise, so I'm going to read the rest of my presentation off the script just to keep on time. And over the next 15 minutes then, I would like to focus on one of the questions that has been posed to our panel, and I hope that I don't overlap too much with Nancy in doing so. As the research team has perceptively noted in the description of our panel, the world of historical documents is changing, thus the world of historical public health policy scholarship will also change. So how will scholarly practices change as a result of this altered documentary environment? It's an intriguing question, and this project suggests some of the ways in which our work will yet indeed change. But I think it also provides a chance to talk about some of the problems, obstacles, and limitations which we might encounter in this altered landscape. So I'd like to divide my talk into essentially two sections. First, talking about some of the ways we can apply what we've learned in this study, perhaps, to other areas of investigation, and then to talk about some of the limitations that might exist on digital methods and big data in general. So with your indulgence, and given that this is in fact an interdisciplinary audience, let me begin by making a few passing observations on what historians are and what it is exactly that we do. Historians, I think, have traditionally approached textual evidence. I say textual as opposed to oral and visual evidence, to be specific. We've approached textual evidence in very specific ways. In broad strokes, historians are interested in explaining change or lack thereof over time. Our sources have usually been paper or microfilm newspapers and periodicals, letters and diaries, official records compiled by state institutions, and private records kept by individuals and corporations. The research phase of our work is always a bit like panning for gold. We sift through thousands of irrelevant pieces of paper. I've gone through dozens of inventories of shirt buttons, to give you one example, in order to find a single reference to our subject. In order to balance the competing demands of thoroughness and timeliness, we tend to frame our projects within narrow temporal boundaries, and we also limit what we do geographically so as to focus on specific bodies of manageable evidence. It's here in the research phase that I think digital methodologies, both in terms of access and analysis, have opened up new and exciting possibilities. 10 years ago, accessing microfilm papers from dozens of cities and towns across Canada or the United States related to flu was a time-consuming process. It certainly was possible, but it was laborious. Digitization changes how we do this type of research. First, it makes newspapers available at the click of a button, which maximizes the hours we can spend immersed in the sources while minimizing the time devoted to the mechanics of access. Anyone here who's waited in agony, I guess, for an ancient microfilm reader printer to cycle through at the rate of about 60 seconds per printed sheet will know exactly what I'm talking about. In comparison, I recently completed an article on flu in Alberta using Peel's Prairie Provinces, which was used in this database, or in this project here, as well as another Alberta database called Our Future, Our Past. The latter contains many papers, none of which have been OCR, literally dozens of them. Even without the benefit of keyword searching, though, I was able to go through almost 24 titles in a matter of a couple of weeks, basically saving stories and coding them as I went instantly. Now, of course, I still put in long days, but it's not really possible to complain when I was able to do most of my research in my pajamas. And of course, I was merely transposing the old scan and print methodology to a digital medium. Even so, the same task would have taken the better part of a semester only a few years ago, and would probably have involved several trips to regional and provincial archives. So an exponential increase in research efficiency is the first major shift, I think, of the digital era. That's probably something that's already self-evident to most of us. The second and probably most important change is in the analysis phase of our work. OCR software has at least theoretically opened up new worlds. Keyword searches essentially automate the old manual process of scrolling through microfilm. In essence, the computer does the sorting for you. As this project demonstrates, though, it doesn't end there. Computer-assisted analysis of extracted data promises to also help us analyze the results. I was especially intrigued here by the idea of using a computer program to code hundreds of articles according to tone or effect. The possible applications for this technology, I think, are endless, provided that it can be perfected. Instead, it could help improve our efficiency through automation while pondering new topics or new tools for comparative analysis. Let me give you an example. In historical investigation in general, there's a constant tension between the available evidence and its representativeness of actual historical experience. Sometimes the papers that survive only exist because, in fact, they are unusual. So how are we to judge whether our example is, in fact, representative of a larger experience or not? I'll give you an example of what I mean. One of the main problems I had in writing a national study of flu in Canada was in defining a normative experience against which to measure variations in local responses to the flu crisis. Was the advice, for example, of doctors in Calgary similar to that given by physicians in Halifax? It was difficult to say when the Calgary papers printed several columns of advice, but those in Halifax not. In Vancouver, one prominent doctor suggested that germs in fact pose no threat to the population whatsoever. He was apparently still operating within a hybrid kind of miasmatic humoral model. He was an old doctor. Others suggested that comprehensive vaccination, though with an untried serum, would have been an excellent and essential public health intervention. But what in fact constituted typical advice? At the same time, how did professional discourses compare to those surrounding folk remedies and lay cures? Comparisons of this sort have always been possible, of course, but they are inherently time-consuming and essentially subjective. For me, this study appears to unlock a number of possibilities for measuring the significance, or at least the pervasiveness, of particular points of view. To determine whether a discursive thrust is typical or abnormal involves measuring one thing against another. In this study, topic models were constructed for each of the 24 weekly newspapers, to use an example, and the results compared to a 25th aggregate model. On their own, I think these reveal the diversity of local coverage as well as the usefulness of newspapers in disseminating public health information. While I'm skeptical that word clouds and topic modeling on their own will tell us very much that we did not already know, I think that the value of the concept is in allowing historians to compare specific types of discourses across time and space to a norm. Furthermore, I could envision using this type of analysis in combination with mortality data to examine how different public health discourses may have interacted with mortality. Did towns where the words quarantine, placarding, or isolation were used frequently, did they in fact experience lower death rates than those in which those words typically were avoided? An additional way I could envision using the word clouds and topic models would be to model individual types of coverage or stories across all newspapers in a region or perhaps a country. For example, editorial pages could be similarly rendered into models, as could letters to the editor or advertisements, which would again provide a normative kind of sample against which you could measure regional variations. Now, in my own research, I found that the Edmonton Bulletin, which I used as well, used the flu to get around censorship regulations that forbade criticism of the Canadian government's war policy during the war. Instead, the editors of the Edmonton Bulletin critiqued how the government handled the pandemic. In general, I detected a broader shift in the language of editorials from across the country, even in pro-government newspapers, which suggested that the flu was bringing latent disaffections to the surface. The approaches described this morning, though, would have allowed me to look at how language patterns changed over time, comparing discourses from the pre-flu period, pre-crisis, to how the government policy was described in the fall of 1918. This would have allowed me to measure with some degree of reliability, instead of the subjective way that I had done, this type of tonal shift that I detected and provide some kind of a statistical basis to describe it. You'll note that these examples, though, all marry subjective analysis to quantification, and this probably reflects my own bias as I seek to imply both types of analysis in my own work. It's natural, then, that this is what intrigues me most. But I think I must drive a point home here. Any computer-assisted form of analysis, be it tone analysis or discursive, is at its core a form of quantification. To be meaningful, it must then correspond to certain standards. For those of us who are not historians, it is worth noting that my discipline has always, I think, had an uneasy relationship with quantitative history. In its first iteration as cliometrics, which is what it was called in the 1970s, quantitative history revealed much about the hidden realities of everyday life. The use of card readers, Fortran, and then database software allowed researchers to systematically examine previously impenetrable records that contained little narrative information. Computation allowed historians to ask new questions. You have to understand that as historians, in the past, if you were looking at the lives of average people, it was really difficult to get at what it was like to be a shoemaker, for example, in Woolwich or something like that, because that shoemaker probably left no letters or diaries or anything like that to describe their experience. But looking at court records, looking at pay records, credit ledgers, these sort of things, allowed you to kind of paint a life pattern of what life would have been like for this individual. Cliometrics allowed people to ask new questions, such as, how was peasant culture affected by reforms to the landholding regime in rural 18th century France? How did wages change again in the British shoemaking industry during industrialization? What was the caloric intake of slaves on Southern American plantations as measured by bags of flour purchased by slaveholders? As this final example suggests, though, we must be careful to nuance and caveat our findings. Quantitative analysis relies on the survival of particular types of documents, specifically standardized facts and figures for a given period of time, as well as the reliability of the actual information that those figures contain. As we move into what would probably be described one day as a new age of digital cliometrics, we should probably bear in mind Herbert Gutman's critique of Time on the Cross, the controversial computer-assisted study of economics of slavery produced in the early 1970s, from which I drew my third example question above. Gutman suggests in his book, Slavery and the Numbers Game, that an average or sum derived from erroneous, unrepresentative, or flawed numbers is meaningless and therefore distorts our understanding of history, which at its core is about why things change and what the experience of change means to people big and small. The lesson of the first cliometricians then, which I think applies equally today, is that just because you can count it doesn't necessarily mean that you should. Just as this study raises a number of intriguing possibilities for future research, I think it also reminds us of the limitations of the data that we're actually working with. We can't ask big data to answer questions, in other words, which it is incapable of addressing no matter how tantalizing the process. In the first instance, computer-assisted searching and analysis is limited to typewritten documents, at least until we discover a way of OCR in handwriting. If anybody's ever read 18th or 19th century handwriting, you'll know that's probably an impossibility, although sometimes it is more consistent than it is today. This outright excludes a vast array of sources, but that is a question I think we have to leave aside for another time. Presuming, though, that we limit our discussion simply to digitized newspapers, I think, again, and something that's come up a number of times, the quality of the OCR will, at least for the foreseeable future, remain a significant issue. As the team points out, the OCR in some papers is so bad so as to make the results entirely meaningless. Artifacts in the microfilm tape or lens, a poor contrast ratio, and the slight tilting of the image all impede accurate machine recognition, sometimes pushing errors, in fact, into the word lists that are, in fact, so common. Any method which is based on quantification requires that the source be almost wholly accurate. It strikes me then that if we are to employ various forms of automated analysis, we must also develop some means of measuring both error and confidence levels. This will involve determining levels of inaccuracy and the probability that erroneous or missed results are built into the OCR text. By way of an example of how this simply works, we can easily determine the number of hits that would be returned for a search with the word influenza for the 28 Alberta newspapers in Peel's Prairies provinces for the entire year of 1918. It's 1,207. This amounts, though, to only about 43 instances per paper for the entire year. Now, a manual examination of the papers in that database, though, reveals that this is in fact a low number and is probably an artifact of the poor OCR. In fact, some of the newspapers never actually appear in the search because the OCR on those specific newspapers is so bad. Manually cleaning the OCR text can in fact fix some of these issues, it is true. But we need to ask ourselves whether the work involved in editing tens of thousands of pages of text will be proportional to the value of the results produced. Either way, statistics, regardless of how they're visualized, become useful only when we can accurately measure our confidence in them as defined by the possibility of error. Sampling bias here, I think, is another point worth reflecting on. Again, in the Canadian context, because it's what I do, Peel's Prairie provinces does not include many of the most important Western newspapers of the era. Manitoba Free Press, the Winnipeg Free Press, the Winnipeg Tribune, the Regina Leader-Post, or the Calgary Herald. It does, though, contain a large number of smaller regional papers with limited circulations. These often serve unincorporated areas like the Bow Valley, for example. Now, the team attempted to use papers from larger centers, it's true, but these are difficult, I think, or impossible to integrate into the analysis, and that's an important point. In large measure, I think this is due to the fact that these are the papers that are most easily monetized by companies looking to sell subscriptions to libraries and genealogies. The reality is most people want to read papers that they've heard of, not obscure papers, which is why it tends to be government or non-governmental organizations that digitize the smaller newspapers. So my second major question then is this. Are the source materials currently available for big data analysis capable of actually answering our research questions? Or do we run the risk of producing aggregates based on unrepresentative or erroneous source materials? Here I think of the public health officer case study specifically. Copeland was certainly quoted in a wide variety of regional and small town papers, but had the team been able to include newspapers from larger urban centers, I suspect that the voices of local officials probably would have spoken louder. This is at least the case in Canada, I'm speaking again from my experience with those records. While the voices of provincial and municipal public health officials in major cities dominated coverage in urban papers, they had far less of an effect on how an editor in Camrose, Vernon, or Fort Williams, small towns, actually covered the pandemic. And I think this is, again, and it's something that was alluded to a minute ago, this is because small town papers in Canada, as in the United States, relied so heavily upon American wire services for their hard news. So while we might be able to say that Copeland's discourse reached a substantial audience, I'd be hesitant to attach meaning to the finding, as it may simply reflect a New York bias in wire service reporting. So what conclusions then can I draw from this critique? First, I think digital history opens up many new avenues for research by making us more efficient researchers through improved access to source materials. More than that, I also think that the research team has proven a concept here, which is in itself no small feat given the obstacles that they had to overcome. They have shown that it is possible to use computer programs to engage in meaningful quantitative analysis and to automate the functions of more traditional qualitative approaches. But I would add, only so long as the method is applied to the appropriate materials. I think it's important to admit that the usefulness of this type of approach will always be limited by the quality of the original source material. Which makes it ironic then that these techniques are most applicable and useful for the biggest data sets, like repositories of newspapers, because as the size of the data set increases, so too will the probability of significant fatal errors in the OCR. At the same time, the possibility of cleaning the data will decrease in proportion to the growth of the sample size. These, I think, are limiting factors. And I think it's also an important caveat. At the moment, in my view, digital analysis is most effective for a defined, probably regional group of newspapers, analyzed over a short period of time. In the longer term, I hope that OCR technology will improve, as will the portability of data from one platform to another, in order to allow us to apply this type of technique on a national or even a transnational scale. And I think that's ultimately the goal. It is those levels that I think that these techniques will have the most impact, as they will not just automate a manual process, but make the impossible suddenly possible. You can imagine, it's feasible for me to go through Alberta newspapers and look at all 24 of them for a span of 4 months manually on my own. It's feasible and possible. You can't do that for every newspaper in the United Kingdom or in Canada or in the United States. That's where automation, I think, really is most important. It's at those levels then that I think techniques will have the most impact, as they will not just automate the manual process, but make the impossible task of evaluating hundreds of sources now possible. It's worth suggesting, I think, that going forward, one of the most useful developments would be to standardize the format and techniques through which newspapers are digitized, perhaps establishing some form of a universal protocol, which we don't have anything like today. It might also be wise, if ambitions are to be realized, to partner with companies like Google, although I am somewhat loath to say that, which seems to have developed a reliable OCR and digitization method through its Google Books project. There are also non-profit alternatives like the Internet Archive that could also be pursued, but they've also had their own problems. These, I think, will be difficult tasks, but ensuring the representativeness and the reliability of the source material is an essential prerequisite before we can actually deploy these exciting new methods to unlock the tantalizing potential of big data. So thank you very much.